friends, the part of Psycho-Hygiene Development. In this episode, I would like to speak about how to overcome depression. Depression is an unpleasant emotion which appears whenever there is a loss, pain, failure, and frustration. The common situation in which we feel depressed are: the first thing is separation from loved ones, breaking of relationships, death, loss of money, status, health, material, power, position, property, failure in examination, in achieving the objectives of goals, failure to complete the work or task assigned, comments, criticisms, ill treatment, hostility from others, discrimination, poverty, unemployment or underemployment, needs and expectations not fulfilled, injustice, stigmatizing, life-threatening, disabling illnesses, no recognition, no rewards, getting punishments. When we are depressed, the following symptoms appear: feelings of sadness, unhappiness, and crying spells, lack of interest, and inability to enjoy, being dull and withdrawn. We become slow both in physical and mental activity. Ideas of hopelessness, helplessness, and worthlessness. And frequently comes negative thoughts and irritability and anger, and the person becomes so aggressive. Life appears to be meaningless, and in some cases the people feel strong death wishes and suicide ideas, self-blaming or blaming others. And some physiological symptoms also sometimes comes: decreased appetite, sleep, and sexual function, poor concentration, and memory, inability to take decisions. Apprehension that some more loss may occur, feel lonely, medically unexplained pain, weakness, fatigue, giddiness, and pulling of nerves, fainting. In majority of people and occasion, depression lasts for a few hours to a few days. The person somehow recovers and gets rid of the symptoms by taking support from others, accepting the reality, making necessary changes in his attitude, and manage to do day-to-day activities. If he cannot, then depression reaches the portion of an illness. If depressive symptoms are present for more than 2 weeks, if the person fails to take care of his needs and becomes disabled to carry out his routine work and responsibilities, if he makes an attempt to end his life or take decisions which are detrimental to the welfare and safety of the family members, the person is said to be suffering from depressive disorder. In some cases, there may not be any reason for the onset of depression. This is endogenous depression, which is a biological illness due to deficiency of dopamine, serotonin, both of the neurotransmitters, or decreased level of thyroxine hormone, comes hypothyroidism. Depression can also result in alcohol abuse. It may be associated with tumors in the frontal lobe of the brain. Depressive disorder is more common in such people. Women during childbearing age, premenstrual tension like headache, body pains and mood, irritability, insomnia, nausea, vomiting may be part of depression. Depression may appear during pregnancy, immediately after the delivery of the child, or during menopause. And second thing is, at the time of retirement, many people are not prepared for inevitable retirement. They consider it as a loss of money, status, power. They anticipate rejection by the family and society after retirement. The next thing is old age. Declining physical and mental health and abilities. Economic problems, loss of spouse, separation from grown-up children, deficiency on others, impending death and dying make the individual prone to depression. The next thing is migrants, minority and other vulnerable sections of the community. The next is people who live alone, away from their family. The next is people who face more life events, who lack social support. Thank you. God bless.